Hello, everybody. Welcome to the show. Well, I think I've done over 70 shows and I have yet to have on a pediatrician. So lucky you that you've tuned in today because God knows we need to
Awesome.
talk to a pediatrician. So thank you so much for joining us. I'd like to bring everybody Dr. Regina Hardin to the show. Say hello, Regina.
Hi. Hello, everyone.
It's very exciting. We had a nice little chat before we get started today. I wanted to talk about ADHD and the way to do pediatrics in 2020 before we got started. So I'm very happy to bring you Dr. Hardin. She's going to help you today. Trust me. So stay tuned. Dr. Hardin, let me first ask you, how long have you been in this Tampa Bay community?
I have been in the Tampa Bay community. I was actually born in the area. I was born in St. Petersburg, so I am a St. Petersburg native. Yay!
I love it.
Yeah, go ahead.
And then you went to school in Atlanta?
I did. I did medical school in Atlanta, and then I came back home to do my internship year at the University of South Florida in Tampa. So, and then after that, I did go back to Atlanta to finish residency, and I stayed in that area for the most part. I did move back to St. Petersburg in 2014 so that I could be closer to my parents who are still here. So they are happy that I have moved back as well. So, and I've been in the area since that.
Oh, that's fantastic. So like many of you know out there, I ran Pediatrics. I was the administrator of one locally in Clearwater and Oldsmar for 8 years. I left that practice 7 years ago and started the Doctor Whisperer because I knew one thing was for sure, that all doctors needed help with business.
Yes. We don't get that training in medical school.
And we don't want you to, because we want you to stay really amazing with helping our children, right?
Yes.
I mean, when people say to me, Dr. Sharon are so bad at business, I'm like, good, please keep them that way so they can focus on what they're good at. Like, I really suck at accounting. You don't want me to be your accountant, I promise you that. So we leave that up to the experts, right? So now
right.
you have
good point.
You have branched out on your own, which I'm very, very happy about. You focus, well, you have a love, let's say, for ADHD, which I do too, near and dear to my heart. And I know a lot of people want to hear about your thoughts about attention deficit, because it's such a big, big factor with a lot of children today.
It is a big factor. And, in schools, a lot of what we have, been under the impression, it's been ADHD, could be, a lot of other different things. Unfortunately, when we have a child who may not be learning or who might be getting into trouble, that's going to be one of the first things that that might be brought up. Oh, maybe they have ADHD. But a lot of it, a child who has anxiety, could be acting out because they don't want to do whatever it is you're trying to get them to do. A child who, is depressed, maybe, inattentive and sort of sitting back, and you might say, oh, maybe they have attention deficit, or they may have some or the other sort of learning disability. So, one of the things that I, work for is to make sure that we have an accurate diagnosis. And so that is, one of my, primary goals, because, of course, with treatment, you have to decide, are we going to do behavioral management? Are we going to do medication management? And that is a big decision for families to make. So you want to make sure you have it right.
Yes. So you do a thorough exam. So here's the thing that I love about what you're doing. There's many things, but let me start with this one. As somebody who ran a pediatric practice, I know firsthand that the doctor just is not allowed a lot of time with the patient. They're just not. And that's in most medical offices that are run by insurance. So we're going to talk about the difference of what you're doing in comparison to this. But we would see in my practice up to 100 patients a day sometimes with 4 doctors. Now it's crazy to keep up with that kind of schedule. By the time lunch came, they were like, oh my God, like just give me 5 minutes to breathe. Plus, they're
Right.
going to the hospital beforehand. They're seeing the babies right when they're born.
Hmm.
There's so much that goes into being a pediatrician. Your practice allows for the opportunity to spend a little more time, which would enable you to make a diagnosis that is not
It
like
does.
thing
It
that comes to your
does.
mind, right? Okay,
It
so tell me
does.
about that.
Right. So my practice is a new concept, or at least a new concept to pediatrics, called direct primary care. So I don't work with any of the insurance plans. I'm direct, I have direct, the families have direct contact with me. I can spend as much time as I want with the family for whatever reason I want, without, the confines of having to see so many patients in order to make, in order to make ends meet. So I can spend, for, especially with, an ADHD evaluation, that's going to take at least an hour. And routinely we don't have an hour to spend with patients. We can only spend, maybe 15 minutes or so. So I, do offer, those extended visits, without any wait time. I don't have a waiting room. If your appointment is at 2 o'clock, you are seen at 2 o'clock.
No way.
Yes, yes, yes. And so, the plan is you call and you text me or whatever it is to, let me know that you're waiting, and I let you in and we see you, because, of course, with the days of COVID, the way that we're seeing patients now is a little bit different anyway.
So let's talk about that because,
Okay.
there's only one specialty that I haven't spoken with since doing
Hmm.
the show, and we're 75 shows in, um,
Yeah.
and that's pediatrics.
What?
So, yeah, I know, it's been busy. And I've been wanting to, so I was so happy to get connected to you through Jessica Ravelli of Working Women in Tampa Bay. I know that you had been following along on Instagram with me, which was great
Right.
because, but I'll tell you the truth. When this first started, I was so grateful I wasn't running a practice. Now, I know that might sound selfish to some of you, but I could not even imagine. It's already so stressful.
Hmm.
But then to be running a practice with 33 employees, 2 offices, a night division, oh my God, like everything changes, everything comes to a halt. You have to redo everything.
Right.
The thing that there's so many things I love about what you're doing, but one of them is that you could actually go to somebody's home.
Yes, that is an offering of mine as well. I am a home visit pediatrician too. So I can come see you and we can follow the, appropriate, social distancing guidelines, all of those things. That I can see your child, on your porch. I can see your child, in on the back porch, under the carport, however, you'd like to do it. And so I know a lot of families don't want to have to go out, especially, even to visit the pediatrician, because they're afraid of coming into contact with, some of the other things. But, I try to limit all of those as much as possible, and I make it convenient for the family. However it is you want to see me, whether it be via telehealth, virtually, that as well. If you want to speak to me by phone, if you want to text me, you will get me directly. So you'll get me directly. So you
I
don't
love
have
it.
to worry about, all.
We're in a different land. So the fact that I know when I was running a pediatric practice, one of the things that most parents were concerned about were coming to the office because there were going to be other sick kids around. So
Mhm.
you don't have a waiting room.
Exactly.
You've eliminated a problem. You also have telehealth. So
Mhm.
how does that work with your company right now?
So what you would do is you would call. You would make an appointment for a virtual visit, and then we would connect through my EMR, my electronic medical record system, and then I would see you just as I would see you in person. Now, of course, it couldn't be virtually as extensive as it could be in person, because, there are some things you just have to see in person. So, and if, we deem that to be, the concern, then I would, of course, see you in person, either in the office or either for a home visit.
So I
But
want to
if
talk.
you've got like a, if you've got a cold or if you've got a rash, of
Yeah.
course, or if you have a fever and you want, some advice as to how, how best to go forth, then, a virtual visit would be okay for that.
Yeah. Okay, everybody. So I won't even, this is 2020. This is in the world of COVID-19. We're not going to be like, oh my God, telehealth. No, this is the world that we live in now, everybody. Okay. I have gone to see 2 doctors now via telehealth for myself.
Mhm.
My stepson has gone to see his dermatologist via telehealth. My husband. So we're all doing it.
Yes,
Karen,
exactly.
everybody, that has said that, oh, we have to go in person. Okay, my parents are very happy now that I have taught them how to do telehealth, and I don't know if they're ever leaving their homes again. So that's what I want during COVID-19. I want to keep everybody safe. We should want to keep everybody safe and prevent the spread of this virus, right?
Right, right.
So the other thing, I want to dispel some of the rumors.
Mhm.
So what people think about direct primary care is, oh, it's too expensive. And why would I go to something that my insurance doesn't cover? Well, let's talk about, if we just compared it to how much Starbucks everybody's drinking. There's there's a lot of cost to coming to the things that we want. If you want a physician, first of all, it's not expensive, and I'm going to let you talk about that. In
Okay.
my opinion, direct primary care is like the only way to go. Direct primary care for pediatrics, for all of the people in my life that have said, Sharon, you don't know anybody that's doing direct primary care yet in pediatrics. Well, here she is, everybody. Okay. I have brought her to you.
Hey.
This is fantastic news for all of us. This is a system that works because you want to have access to your doctor via text, via having an hour-long consult and not being rushed out the door because you forgot to ask a question because you were being
Right.
rushed. Do you have other you have like medical assistants or nurse practitioners? Is it just you, the doctor? I
It's
love
just me. Just me, just me. So
so
you would get me on the phone, you would get me
yeah,
whenever you
whatever.
called, whenever you came in. So,
I
no
love it.
worries about seeing anyone different because I'm the only provider with my practice. So,
So what has it been like for the children that you have seen or spoken with during this time of COVID-19?
well, a lot of families, I think, have been concerned because I think primarily with isolation because, kids, are social people. So they want to be out and they want to see their friends. I have a high schooler at home, right? And so, she's dating. So it's
Ooh.
been, I know. So it's just been, a big thing, can we see each other? And, some of my friends who have kids, they've said, well, Regina, my daughter's depressed, what do I do? I mean, she can't interact with any of her friends. So, I would just suggest, with Zoom now, Zoom is another platform that we're able to use to see each other. So, that would be a suggestion, have a get together, on Zoom, something like that. Allow some outside time, especially, you can go for a walk around the neighborhood without, coming into, really close contact. You have to get out there. You have to get some sun.
We have to live our lives.
Yes, we
Yes,
will. Yeah, for
we have
sure.
to live our lives.
Hmm.
So, well, I'm really excited. I've been thinking like maybe I want to ask the audience what questions they have, and maybe we can do
Hmm.
another part 2. Because
That would be great. Yeah.
as soon as I posted that you were coming on, I got a lot of engagement.
Okay.
And because I have so many friends that really want access to their doctors,
Hmm.
that doesn't require getting in the car and getting the kids ready, driving into the office. They want somebody that is more, 2020 focused, and that is you. So tell me about the pricing model.
So my pricing model will be age-based or tiered based on age. It will start out at a higher price point, especially for infants, because we do have to involve vaccinations. We do have to see, the babies, more than we would have to see, say, a teenager,
Right.
right? Who might not ever get sick at all.
Registry.
maybe once or twice a month, but you're going to see your babies. You're going to see them at least 3 or 4 times a month. And
Right.
so, with that, I'll have, one cost where, you can come in, as much as you need to come in without having to worry about an additional copay.
Mhm.
Like if you have an insurance that would have, say, a high deductible, you have to, pay the amount that you're responsible for, if you come 1 time a month, if you come 3 or 4 times a month, if you haven't met your deductible. And if that cost is, say $100, you've got to pay $100 every time you come in. So, we eliminate that. So the only extra cost that you might have might be for vaccines, and those can be worked out as well. So those can be, obtained from the pharmacy. We can get those from the pharmacy, and sometimes the pharmacy can actually get those covered through insurance. So there are ways that we can work that out.
I love that.
Yeah.
Mhm.
Yes. And then, for like labs and x-rays and things like that, we have pre-negotiated costs that are much lower than oftentimes that you would even get through insurance.
Yeah.
So, and it's just, yeah, and it's just a kind of like a mindset. We kind of, we'll say, well, we have to have insurance to do this, to do that. But, you really, can, save your insurance for the big things, for like, hospitalizations and things like that, that will cost, so.
Yeah. So I'm just so excited about this. And I get caught up in these conversations. I forget I'm interviewing somebody. So I love that you have this and that you work with people. I know that there is a direct primary care physician that belongs also to Working Women at Tampa Bay. She's adult medicine.
Got it.
And
Got it.
yeah, and I know that when we went over the pricing structure, my goodness, the savings was actually unbelievable. So whatever anybody that's listening or watching is thinking about a cost when it comes to direct primary care, especially for pediatrics,
Mhm.
whatever it is that you think, just throw that out. Just throw it out, because there are so many innovative ways of obtaining what you need without going through the insurance mess. I mean, let's just be real. It is a mess today that this plan, this card that you hold, is dictating how you're going to get the best care. The best care can come through these wonderful programs like direct primary care that have memberships, that have texting available with your doctor,
Mhm.
that have telehealth available with your doctor. Um,
Right. Right.
this is a big thing. And so everybody knows, when it comes to pediatrics and you want to go into the well room and not be around the sick kids, but
Right.
come on, people. Like, you can catch more germs in line at Publix. And now with, anxiety and depression, the kids are living through an unbelievable time. And they need to be able to spend time with the physician that they trust now more than ever. And the fact that you can spend that time and then make that
Mhm.
necessary referral to whoever it might be, a psychologist or a psychiatrist that will work with you and collaborate. Because even with ADHD, like we were talking about before, there's
Mhm.
a whole team of people that need to corral and help the children when they are
Right.
diagnosed.
Right. And imagine those kids with IEPs and 504s, 504 plans that, where in school they had all of, these resources. So now families are left trying to figure it out as far as, how am I going to get the same help if my child is doing school at home?
Yes,
So it's, yeah, there's a lot, a lot happening currently.
a lot. And now with, I know Cooper just started back today. Today's his first day back in school. He goes to a private school, and is a lot of fear, not so much for him,
Mhm.
more for me, that he's going to walk into a place where there's a good chance that he could contact COVID-19, and we're
Mhm.
just going to have to wait. But to know that if I needed to speak to you, I could right away is
Exactly.
a huge gift and a huge blessing. So I have just decided we're going to do a part 2. I want everybody that has questions, specific questions, I want you to put them in the comments below, or even if you're just listening on the podcast, in
Mhm.
our show notes, they have a way to contact me and ask any question. And then the next time you come on, we can have a great conversation and get more specific about the questions that everybody has.
Yeah, that would be great. That would be great.
Dr. Hardin, thank you so much.
Thank you. Thank you for having me.
Yes. Do you
You
want
know,
to share?
one funny thing about my daughter,
Yeah.
she started school today as well. She started the St. Pete College dual enrollment program. So their classes started today, but her school starts next Monday. So today she's like, she says, school? I have school today? I said, yes, your class starts today, right? She goes, oh, college. That's the same as school? I'm like, oh, yes.
Oh my
Come
goodness.
on, come on. And it's been sort of, trying to, even because kids have been at home since March, right? They've been at home since March. So now, we've got to sort of get them back into the routine of going to bed at night, getting up every day and focusing on school, right? So.
Come on, are you kidding? At 10 o'clock last night, we had a phone call from Cooper. He stayed at his mom's last night. Like I mentioned, he's my stepson. And he asked how he was getting home. I'm like, come on, kid. You're 16 now.
Right.
Figure that out on your own. Not 10 o'clock the night before we go to school. But really and truly, I say that, but we even have to be a little more patient, even more so today, because the kids have been at home.
Yeah.
And going back into socialization, they're going to be so excited to see their friends. How are we going to keep those masks over their noses? I have no idea. But we'll all work together as a community. Thank you again for joining us, Dr. Hardin. I look forward to having you back. I'm going to say, hopefully, if you're available next week, so we can get some questions answered, because I know people have a lot of concerns, especially now with the kids going back to school. You're a hot commodity.
Very good. Thank you so much. I'd love to come on again. Thank you. Thanks for having me.
Thank you. So don't forget, if you mention that you have seen the show or listened to the podcast, Thai Technology, 3 months for free.